In this video, we're going to talk about intracranial pressure. Intracranial pressure, or ICP, is the measuring of how much pressure is inside of the head. Now this is important because if the levels are too high, then it will put pressure on the blood vessels in the brain and it will decrease the blood flow and oxygen that can be supplied to the brain. Now ICP is important for patients that have had head injury, patients with stroke, especially hemorrhagic stroke, hydrocephalus, or head tumors, for example. Now, ICP, the intracranial pressure, should be between 10 and 15 millimeters of mercury. When it's over 15, as I told you, it closes off the supplies that the brain needs. Now, how do you measure it? There are three devices that I'm going to point out here. You have the intraventricular catheter and the subarachnoid screw or bolt. These two here can actually drain out some cerebrospinal fluid to lower the ICP in emergent situations, while also giving you what the ICP is at that current time. Another is an epidural or a subdural sensor. Now, once you have ICP in, as far as just general maintenance, you're going to want to go ahead and change the dressing when it's needed per policy, and also watch for signs of infection because it's penetrating the skin, so you want to check for drainage, redness, and the typical signs of infection. You also want to make sure that the device is calibrated properly so you're getting the proper results, because medical decisions are going to be made off of what the ICP is said to be. And then you want to do your general patient assessment. So this includes monitoring the ICP, monitoring the Glasgow Coma Scale, head to toe, and vitals. Now, what are some signs that the ICP is elevated? Well, the first noticeable sign would be a change in the Glasgow Coma Scale or the level of consciousness. And this is because there's being changes on the brain. Some more body-wide issues you can see. Well, the pressure in the head is going to cause a headache. The respiratory and vomiting centers of the brain, as well as the eyes, are going to be affected. So you can see changes in respirations and possibly Cheyne-Stokes respirations. You're going to see you can see vomiting, which is a sign that ICP is elevated. You can see pupillary changes if the ICP is elevated. And so the big ominous sign that they want to tell you on the test is two bilateral, fully dilated pupils that are unresponsive. But that's not the only case. You may have one pupil and the other is large and the other one's small, or you may have them to where they react to light or don't react to light. Also, you may have changes in the body temperature, and they might become elevated, and this elevation in blood temperature can also further increase ICP. Same way, the blood pressure can rise, and when the blood pressure rises, it can also further rise the ICP. You also see the pulse rate will drop in response to elevated blood pressure because the heart's trying to slow it down to maybe compensate for the high blood pressure. Some late signs would be changes in positioning, which you have to do with Glasgow Coma Scale. You have to decerebrate and the changes in... Fuck! Some late changes that you'll see in the signs and symptoms would be changes in positioning, which are measured by a Glasgow Coma Scale, or you may see seizures. So treatment for patients that are receiving ICP monitoring includes ventilation is typical because by using a ventilator, you can control the patient's respiratory rate and in return monitor their carbon dioxide. So a normal patient's carbon dioxide should be between 35 and 45. However, in this case, you want to keep it between 30 and 35 because carbon dioxide dilates blood vessels. And so if it dilates the blood vessels in the brain, it can increase the amount of blood flow going through there in a way that it can increase the ICP. Now, when they're ventilated, you're probably going to have chemical or medicine-induced unconsciousness, and this is going to be assisted because it can also decrease stimuli. Because the more the patient sees going on around them, the more they're trying to use their head, and what happens is it can increase their ICP. Now you can also help by turning off the lights, no loud sounds, and stuff like this nature. You want to prevent shivering in the patients because that can raise their ICP. These patients may need to be on fluid restriction, so there's less fluids backing up in the body and backing up into the brain. You want to be sure to avoid straining. For example, Valsalva maneuver if a patient has constipation, or bending over. You want to keep them on bed rest. And the reason being is whenever they strain, it will increase your blood pressure. And I told you high blood pressures lead to high ICP. And so for a patient with constipation, you may want to give laxatives or stool softeners. You want to keep the head of the bed at 30 degrees with the head midline, no hyperflexion or hyperextension. And that way you have a good adequate blood flow going through and from the head. As far as medications, you can see anticonvulsants to prevent seizures, antipyretics to prevent fevers, blood pressure medicines to keep the blood pressure in a good range, steroids to decrease swelling, and you can see hyperosmotic diuretics, which will pull fluid out of the cerebral spaces and diurese the patient. So these hyperosmotics can help to lower the ICP, as well as using one of these two devices to drain off CSF. So this is intracranial pressure in a nutshell.